This is critical thinking on the second part of the endocrine system, and here are the questions. So this is the first question on certain hormones, some of which you did earlier, some of which you do in the second portion. This is a question on trying to identify the false statement. Here is where you again have to find out which is not a hormone-based pair on based on their antagonistic action. And lastly, here is something to do with hormones which raise the blood pressure. Now let's go to the first one, where it tells you that Fred is involved in an automobile crash and is bleeding profusely. So naturally his body tries to maintain hemostasis, or where you try to keep the blood pressure normal, and so therefore effective homeostasis, by immediately increasing the production of which of the following hormones. So let us look at these choices that we have here. So he's bleeding profusely, so you want to make sure that the blood pressure is kept normal and bleeding does not continue, which is hemostasis, and thereby you maintain homeostasis also. So at this point, there is no point trying to, for the body to secrete glucagon. So there's no point doing that because glucagon raises the blood sugar levels. Now, if it does that, it's not going to control bleeding. So this is not one of the choices. Parathormone. Parathormone raises serum calcium. Again, you're not going to take care of bleeding, so this again would not be one of the choices. Thyroxine. Now, thyroxine does a lot of things, one of which is to to maintain blood pressure, but here you want to immediately increase something which will stop the bleeding. Thyroxine by itself does not have anything to do with bleeding. It does not cause vasoconstriction or will not stop bleeding. Hence, thyroxine is not a hormone that is going to be produced either immediately. However, the last choice, which is epinephrine, this will be a hormone which will produce, because epinephrine has a vasoconstrictive action. Hence, when you're bleeding profusely, if the blood vessels vasoconstrict, the bleeding will stop to a certain extent. And secondly, remember that and when it stops when the bleeding stops, it will also raise the blood pressure and keep it maintained. Plus, remember, epinephrine is produced by the adrenal or suprarenal medulla, and it is a hormone of the flight fight system, the sympathetic nervous system. So this is therefore the correct answer to this question, and so therefore this is the hormone which will be produced. Now let's go to the next question, where it asks you to identify the false statement. So let's look at these choices. So the first one is a tumor of the zona fasciculata will result in increased blood glucose levels. This is true because the zona fasciculata produces the glucocorticoids. And even the name itself should tell you that glucocorticoids, you can see that glucose levels. So these are steroids which increase the glucose level. And actually, this is one of the ways that the glucocorticoids act in stress. During stressful times, the steroidal hormones are produced, and glucocorticoids, or cortisol in particular, and what it does is it raises the blood glucose level, so it allows the body to, because the metabolism and everything else increases during that time, so it helps the body utilize the glucose. And secondly, it also glucocorticoids also help to raise the blood pressure by making the blood vessels more sensitive to the catecholamines, which are epinephrine and norepinephrine. So therefore, if there is a tumor of this region, that tumor will be producing more glucocorticoids, and hence you'll have an increased blood glucose level. So that is true. The second one, which is a person suffering from pheochromocytoma, will show signs of raised blood pressure. Pheochromocytoma is a tumor of the suprarenal medulla. So suprarenal medulla, which means it is going to be producing epinephrine, and we just did the previous question. So if there's a lot more of epinephrine being produced, there'll be severe vasoconstriction and blood pressure would go up considerably. So these people actually show signs of hypertension. So that is also true. So this is also a true statement. The third one, ADH is an antagonist to aldosterone. Now this is false. Because if you look at the actions of ADH and aldosterone, ADH causes retention of water by the body. That means there is reabsorption of water in the kidney tubules. Aldosterone causes reabsorption of sodium, and with sodium, water also gets reabsorbed. So in both cases, actually, water is uh, reabsorbed in the kidney tubules, kept in the body, prevented from going out, and both these hormones act to help maintain blood pressure and blood volume. So they are not antagonists, in fact they are synergists. So this is an incorrect statement. So this is the answer to this question. But let's look at the next statement too. Glucagon and cortisol are capable of raising blood glucose levels through gluconeogenesis. Now, this is a true statement. As I told you earlier, cortisol, which is a glucocorticoid, raises blood glucose levels, and it does this through gluconeogenesis, which is producing glucose from non-carbohydrate sources. So, glucose is produced from non-carbohydrate sources. And glucagon also does that. Glucagon, one of the ways it acts is it breaks down glycogen to produce glucose, which is known as glycogenolysis. So that's called glycogenolysis, where glycogen is broken down. And it also causes gluconeogenesis. So from proteins and fats, glucose can be made. So that's why they're called non-carbohydrate sources. So this is also a true statement. Hence, the answer to this question is the third statement, which is this one. Now let's go to the next question, which says, which of the following would not be considered a hormone pair based on antagonistic action? That means that the two hormones should be antagonists to each other, and they should be having an action on the same substance. So let's look at the first one, parathormone and calcitonin. This is an antagonistic pair because they both act on serum calcium levels, and parathormone increases serum calcium, calcitonin decreases serum calcium. So these two act on serum calcium, but they are antagonistic to each other. Similarly, insulin and glucagon are also an antagonistic pair. They act on serum glucose levels, with insulin decreasing serum glucose and glucagon increasing serum glucose. Let's look at the third one, ADH and ANP. These are also a hormone pair based on antagonistic action because they act on the level of water. So let's look at the level of water in the body. ADH causes reabsorption of water at the kidney tubules, hence increases the amount of water in the body, and it raises the blood volume. So this sort of increases reabsorption of water. ANP, on the other hand, decreases reabsorption of water and also actually sodium. So what it does is it causes the exit of water and sodium from the body. So not only is it an antagonist to ADH, it also is an antagonist to aldosterone, because remember, it does both. It causes excretion of sodium and water. So aldosterone causes reabsorption of sodium and water. So therefore, it is an antagonist to both ADH and aldosterone. So again, this is a hormone pair on antagonistic action. This one, which is growth hormone and thyroxine, this is not a pair based on antagonistic action because they have pretty similar actions. Growth hormone causes protein synthesis, as does thyroxine. They also both act on the skeletal system. So again, thyroxine also acts on the skeletal system. So therefore this pair is not a one which is based on opposite actions, and hence this therefore is the correct answer to this question. Now let's look at the last question here. And this is, all of the following would increase blood pressure by causing vasoconstriction. So that means they directly cause vasoconstriction. So let's look at this. Epinephrine. Epinephrine acts on blood vessels, causes vasoconstriction, and increases blood pressure. So it does that. Angiotensin, as the name itself suggests, angiotensin, it's a tensor of the blood vessels. So it causes constriction of blood vessels and hence raises blood pressure. ADH. Another name for ADH is vasopressin. So very similar, as you can see, to angiotensin. Vaso meaning blood vessel, pressor meaning tenses. So this also causes constriction of blood vessels and hence raises blood pressure. And let's look at the last one, cortisol. Cortisol raises the blood pressure but not by causing vasoconstriction. So therefore this is the choice. So how does it cause raise blood pressure? What cortisol does is it makes the blood vessels more sensitive to the catecholamines, which is epinephrine and norepinephrine. So it makes it more sensitive to catecholamines, which are epinephrine and norepinephrine. And then they constrict the blood vessels and raise the blood pressure. So it indirectly raises blood pressure, but it by itself does not cause vasoconstriction. So hence, the answer to this question is this fourth choice.